in 53 counties in our state. We've completed more than 12,000 tests and have almost 15,000 collected samples pending. Earlier today, we shared that North Carolina has counted our first COVID-19 deaths. It's with a heavy heart that I must tell you that these will not be our last. One person was from Cabarrus County in his late 70s and had several underlying medical conditions. The other person lived in Virginia, was in his 60s, and was traveling through our state when he was hospitalized. This is a difficult time for their families, and I asked the media and their communities, please respect their privacy as they mourn. We know today that a number of patients who are currently hospitalized are seriously ill, and some in critical condition. They are fighting for their lives. And it's awful for their families who know their loved ones are suffering, but because of this cruel and contagious sickness, they cannot even be with them. Today is a stark reminder that we must take this disease seriously. All of us, young and old, employers and employees. This virus can be deadly, and that's why our daily lives have had to change so dramatically. I know it's hard, but it's necessary. In the last few weeks, I've taken significant statewide actions to slow the spread of the virus. We've closed schools, banned social gatherings, closed numerous businesses that can increase the spread of the virus. We've limited nursing home visits, and we have encouraged people to stay home. These actions have been difficult, but necessary to slow the spread. And we know that further action to protect our state will be necessary. We're in the process of working on additional statewide guidance and restrictions that we will be announcing soon. It's imperative that we keep North Carolinians safe, while at the same time doing everything that we can to limit the economic impact of this virus on businesses, workers, and their families. These are difficult, deliberate decisions, and it is important that we get them right. There are also important steps that we can take right now to slow a spike in cases that could overwhelm our medical system. Stay at home when you can. Practice social distancing wherever you are. If you are a business and haven't done so yet, get your social distancing and telework plans in place now. Do not wait. You owe it to your employees, and you may need those plans in order to stay open. I want to again thank our healthcare workers who are showing us what courage means. You do your jobs every day, even in the face of a pandemic, to keep us healthy and to save our lives. Our state is grateful to you. Today, we join together as a state to keep those who are mourning in our prayers. Let's also commit to doing our part to slow the spread of this deadly virus. In doing so, we honor their lives while we protect our communities. I'm joined today by Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, Mike Sprayberry, our Director of Emergency Management, Eric Hooks, our Secretary of the Department of Public Safety, and Nicole Fox is providing American Sign Language. Dr. Cohen, I'm going to call on you to share your update.
Thank you, Governor. I want to also extend my sympathies to the families who lost loved ones. As the governor said, it's a sad reminder about why we have been so aggressive in our social distancing measures. And unfortunately, we will likely see more deaths in North Carolina before this pandemic runs its course. I know this is really hard, but we need to be vigilant to save lives. So I ask my fellow North Carolinians, please hear our request today to maximize your social distancing. Our mandates are a minimum, and I hope you're going well beyond those mandates to protect our communities. As the governor said, if you can telework, please telework. If you feel sick and have mild symptoms, stay home and call your doctor. Your individual actions will help us slow the spread of the virus. I also want to share some positive news and developments in our fight against COVID-19. One, we've made numerous policy changes in our Medicaid program so that our doctors and other providers can really ramp up their access to telemedicine, which allows everyone to access the care that they need in safe settings. We've launched a hotline in partnership with the North Carolina Child Care Resource and Referral Network to provide child care options for children of critical workers who do not have access to typical care because of COVID-19 closures. In just 4 days since setting up that hotline, we've connected more than 450 families to child care. We're also getting food to our kids. Our public school districts, many working with community partners such as food banks and faith-based entities, have served 2.4 million meals and 32,000 snacks since March the 15th. And yesterday, our pharmacy and medical boards worked quickly to protect our medication resources for those who need it. No doubt, there are a lot of challenges, and our new reality of social distancing is hard, but I know we'll get through this. I already see us pulling together. I see teachers finding a way to creatively engage their students. I see people grocery shopping for their high-risk neighbors who are rightly staying at home. I see hundreds of healthcare professionals answering our call for volunteers. Even as we physically distance, it's how we come together that will see us through. And remember, there is help for you if you need it. Many behavioral health clinicians in North Carolina are ready to take new patients and provide care over the phone or by video. More information is available on our COVID-19 website under Managing Your Overall Health. Stay well.
I'll now recognize Mike Sprayberry, our Director of Emergency Management. Mike.
Thank you, Governor. Today is day 16 of the State Emergency Operations Center activation for the COVID-19 response. 48 counties have their local emergency operations centers activated. 94 counties in the eastern band of Cherokee Indians have declared local states of emergency. Our top priority here for the State Emergency Response Team remains getting critical personal protective equipment that our healthcare providers need. Yesterday, we placed orders for $12.6 million in personal protective equipment, bringing the total amount of PPE ordered so far to $65.9 million. We've also increased the size of our sourcing team that is working to locate and order those supplies, and we have also increased the size of our National Guard logistics team that is helping to receive and redistribute those supplies as soon as they arrive. Donations of personal protective equipment like gloves and masks are coming in, and those are greatly appreciated. If you have supplies you would like to donate, you can send an email to our Business Emergency Operations Center. That email address is beoc@ncdps.gov. Again, beoc@ncdps.gov. Helping our public health partners and hospitals prepare for large expected numbers of coronavirus patients is also a top priority. We're working with the Office of Emergency Medical Services to identify additional hospital beds to be available once the regular beds at the state's hospitals are filled. We've also initiated a weekly call with North Carolina's military bases and their leaders to make sure they are well coordinated with the state's COVID-19 response. North Carolina's 211 is also helping hundreds of people each day with assistance and information related to the coronavirus. By dialing 211, people can help with food assistance, paying rent and utilities, support for families, or just basic information. You can also receive information from 211 by text. Just text COVID-NC to 898-211 to get regular information updates via text. I'd like to close by thanking all of our local partners who are there. One team, one mission. Thank you, sir.
We're continuing to prepare. We're continuing to be ready. We're continuing to work to save lives. And we're grateful for all of the good people who are working here at the Emergency Operations Center 24/7 to protect the people of North Carolina. We'll take your questions. Identify yourself and your organization when you get on the line, please.
Hi, Governor Cooper. This is Andrea Blanford with ABC 11. I'm sure, as you know, local municipalities across the state are starting to issue stay-at-home orders. Durham Mayor Steve Schewel said in a press conference just a couple of hours ago that he's confident you will issue a statewide order. And Dr. Cohen just said the mandates so far are a minimum. So can you please elaborate on what needs to happen before you order a statewide stay-at-home order? Are you even thinking about that yet?
First, thank you for that question. We want people to stay home. And local communities are doing what they think is right, and I understand that. It's important for us to make sure that we are deliberate and that we get this right. We're telling people now that we want we will be issuing additional orders soon.
Ashley, can you hear us? Yes. Hi, this is Ashley Talley from WRAL News. Wondering how many people are hospitalized right now, and as our hospitals are running low on PPEs, how much of a concern is that, especially as we begin to test fewer people throughout the state?
It's important for all of our healthcare providers to have the supplies that they need, particularly personal protection equipment, PPE. We're hearing about that all over the country and the importance of it. We know right now that it's the Wild West out there in trying to buy this equipment. We started working on this in January, and we're working to order it from wherever we can get it. We also have convened a number of our textile manufacturers to get some of them on the road to switching over what they do to make this personal protection equipment, because we know that we're going to need a lot of it in the coming months. And we want to make sure that our hospitals, our frontline doctors, our emergency responders, our law enforcement, people like that, have enough of it. But we know it's in short supply across the country. I think we have 49 people. I'm going to let Dr. Cohen give you that number of people in our hospitals, and we are working on data, collecting data from healthcare providers and hospitals across our state, where soon we will be able to give you the number of hospital beds we have available, the number of ICU beds we have available across our state. We want that information and want to have that information so that we can be ready to set up additional hospitals if and when necessary in North Carolina, because we don't want to get into a situation where a person is not getting the kind of care that they need when they have to go to the hospital. So, Dr. Cohen, I'm going to recognize you to talk about that situation.
Thank you, sir. Currently, we have 29 folks across the state who are hospitalized. Again, that is a point in time. We collect those at a point in time the evening before that we're able to share. We get that information now from our hospitals. Previously, we were doing that through our contact tracing. So as the governor said, as we're able to collect more of this information from our hospitals, we want to be sure that we're sharing what are available hospital beds, what are available ICU beds. But everyone should know at this point, we have the capacity that we need to handle patients coming through folk stores.
From CBS 17. I wanted to get an update with the Unilog, specifically in New York, regarding the number of leaders.
Michael, we're having a hard time hearing you. Can you?
An update on the situation regarding the number of ventilators in North Carolina.
Michael, we've had a bad connection.
Connection. I think one of the things that's happening out there, and many of you have experienced it in your businesses, there's so much teleconferencing going on that technical glitches occur, and we're sorry about that.
Lynn? Okay, we'll go to the... Hear us?
I can. Can you guys hear me okay?
Yes.
Okay. This question is for Dr. Cohen. We've seen from the World Health Organization and even the CDC's guidelines on testing that more testing is better, at least in their opinion, and obviously we've changed our strategy here. When looking at the CDC's testing criteria, it does mention saving testing for those that are at risk, are seriously ill, or frontline providers. Did we change our testing protocol out of necessity because we don't have as many tests? Or have we seen evidence in other places that reducing the testing to what we're now doing it makes a difference? Thank you.
Yes, thank you for that question. So the World Health Organization is obviously giving very broad guidance for the entire world with a lot of different settings and different infrastructures. We are following the guidance from our United States Center for Disease Control, and over the last week that they have put out new guidance that is helping shape how we move forward. And what I would remind folks is that this is a rapidly evolving situation. We're trying to gather the best evidence and data that we can, as well as advise folks as we move forward. So right now, the CDC has given us guidance that for those who are sick, we ask them to stay home and to call their doctor. What I'll tell you as a physician myself, I know that testing someone is not going to change the course of what we're able to do. As a reminder, we don't have medicines and we don't have vaccines. So we want to be testing those who are hospitalized, our healthcare workers, those in long-term care facilities that help us deal with infection outbreaks. So that's where we want to be concentrating our testing at this point. What I would say is that we know that we will evolve to different phases of this response, but currently in this phase of our response, we're going to ask folks who are sick to stay at home, to call their doctor. If you have mild symptoms, we want you to stay at home and make sure you're checking in with your doctor to report on your symptoms as you go forward here, and that we're going to be testing and focusing our testing on those who are in our healthcare facilities.
As well, and notice that Dr. Cohen and I are grabbing this mic at different places because we're keeping our social distancing and making sure that we're not doing anything here to spread the virus. But one of the question was about testing, if you didn't hear it, and one of the main issues we have concerning testing is that the federal government did not provide enough supplies and tests across the country to be able to do the kind of testing that we need to do. So we got creative. Some other states got creative in working with our homegrown company here, LabCorp. They started testing. Other organizations have started testing as well. And so we're ahead of most other states in the number of tests that we have run. But there are two main problems here. One, there's a shortage of testing supplies and tests and capacity to run those tests. And two, there's a shortage of personal protection equipment for those people administering the tests. And what the healthcare professionals are saying, because we have those kinds of shortages, that we need the personnel and the personal protection equipment used for people who are sick and who are in the hospital, and making sure that those healthcare providers are there. I think we definitely want to keep working on getting more testing supplies and getting more tests into the system. We need to do that because at some point, if we can test as many people as possible, we have a better snapshot of where we're going and what we need to do. But until this country can build up the supply chain for both personal protection equipment and testing that we need, we've got to concentrate it on the greatest need right now. And the important thing, the overall objective here, is to save lives. And we do that by trying to prevent the spread and getting people to stay home. And we do that by making sure we have excellent medical treatment for the people who do need to be hospitalized. And we're going to work until we get there and make sure that as many people survive this and that North Carolina is healthy when this thing comes to an end. Next question.
Hi, can you hear me?
Yes. Yeah. Go ahead.
Okay. My question is about child care centers. There's several groups that have called on the governor and Secretary Cohen to shut down child care centers and then use emergency relief funds in order to use a select few to help provide child care for emergency workers, medical workers. Is that something under consideration, or is there other consideration to have other funds to help fund these child care centers and these child care needs of families?
Clearly, it is important for us to have child care for our frontline responders, and we want to do that in the best way possible. And I know the Department of Health and Human Services has been looking at all of the options that we have, and I'm going to let Dr. Cohen address that.
Thank you for the question. In terms of childcare, what we've been advising folks, we understand that childcare is a hard issue for folks. What we're asking is for families who are able to keep their children at home. Thank you for that, because we are trying to keep childcare open in certain circumstances for our frontline workers, as the governor mentioned. We put out guidance just yesterday where in order for a child care program to stay open, they must comply with some stricter guidance on how to make sure that they're creating a safe environment for their workers and for their children, and practicing the kinds of social distancing measures that we want to see. So we've put out that guidance and essentially have required folks to adhere to that to make sure that the places that our frontline healthcare workers are getting their child care are going to be appropriate for their families and their children.